So this is our fifth session of the Behaviour Change series, and it's our final session, and it's on the theoretical domains framework and evaluating interventions. Now, the learning outcomes for today are to understand the concept and the domains of the theoretical domains framework, to understand methods to evaluate an intervention, and to also understand what can influence the reliability of an evaluation as well. So I thought it would be useful first off to just run through how to strengthen that process of creating an intervention even more. Now, I haven't mentioned this before, but the theoretical domains framework can add an optional but an even more comprehensive step to the behaviour change wheel process. And the framework itself was developed by an international panel of 32 experts in behaviour change. And implementation researchers noted that there was just too large a number of behaviour change theories, and they just didn't really have a method for selecting and applying the theories to their work. And the theoretical domains framework brings together constructs from these theories of behaviour change into just 14 key domains. And so far, the framework's been primarily used in the context of health to understand behaviour at an individual level, but it can also be used across other areas and to understand behaviour at an organisational and community level as well. Now, each domain of the framework relates to a COM-B component, and the process of creating an intervention using the wheel can be enriched further by using the framework throughout as this optional step. And I think it really helps to understand capability, opportunity and motivation on another level too. And that's why I'd like to introduce you to the domains so that you can keep these in mind as well. And that's both as part of the systematic process, but also to just be aware of what affects behaviour more. Now, as you take a look at the domains, if you think back to session 2 and the introduction to the 3 models, so the health belief model, self-determination theory, and then the behaviour change wheel as well, I hope you can see where these domains could fit within them all. Next, I'm going to just run through the 6 COM-B components, so capability, opportunity and motivation, and those all split into 2, and then to also introduce what each domain is and how it fits into them. So first off, you've got your physical capability. Now, skills is classified as one domain, but this is the only one that fits into 2 of the COM-B components. So physical skills sits within physical capability, and it's just defined as an ability acquired through practice. So for our example of increasing fruit and vegetable intake, a question to ask to understand where your target individual or your population stands here is whether they know how to prepare a healthy meal or can they actually cook. And next is our psychological capability, and there are 4 domains that fit into this. So first off is knowledge, and that's just the awareness of the existence of something. Taking into account our example, this would just involve identifying if a person knows about the importance of eating fruit or veg, or on a really basic level that they know what constitutes as a fruit or a vegetable. We have the second half of our skills domain here as well, and that's cognitive or interpersonal skills. And that would involve being aware of how to go about choosing the right food, so the right ingredients for a meal. Next is memory, attention and decision processes, and this focuses on an ability to retain information given, to focus selectively on aspects of the environment, and also the capability to choose between 2 or more alternatives. Now, this encompasses decision-making processes and attention to carrying out the behaviour as well, and the question here will be asking simply if they do that behaviour already, and are they aware of what they're doing? Do they think that they eat enough fruit and vegetables in a day already? And our final domain linked to psychological capability is behavioural regulation, and this basically covers everything aimed at changing that behaviour and observing that change. This could involve self-monitoring processes, action planning, and also working out what habits to break. So the question you'd ask them here is, do you usually monitor your fruit or veg intake? And moving on to opportunity, so social opportunity first off, and this just has the one domain, which is social influences. Now, social influences are the processes that can cause an individual to change their thoughts, their feelings or their behaviour. And this can include social pressures and norms, conformity, comparison, and also social support. Modelling as an intervention function is something that fits well within this. And for our example, it would be useful to just consider how these social influences affect behaviour, which is something that we've done really well already in previous sessions. Now, physical opportunity as well only includes one domain, and that's environmental context and resources. And these are just any circumstances of a person's situation that encourage or discourage the development of skills and abilities, independence, social competence, and adaptive behaviour. And being aware of this when you create your intervention can be a really key factor in reducing health inequalities and hitting equity within your APEAS criteria too. Now, reflective motivation is where the biggest proportion of domains sit. There are 6 in here. So first off, you've got your optimism. And this is just the confidence that things will happen for the best or that goals will be achieved. So is that person that you're working with optimistic or are they pessimistic? And how confident are they that they're able to eat more healthily and that this will improve their life and outcomes as well? Next, you've got your beliefs about consequences. So this is about accepting the truth or validity of outcomes of a behaviour in different situations. So just asking what would happen if they ate more fruit and vegetables. Next is social or professional role and identity. So a person generally has a set of beliefs and behaviours in a social or a work setting that they tend to upkeep. And the question here would be just how can we understand how that behaviour fits in with this, and is it acceptable for them to change in this arena? Beliefs about capabilities is the acceptance of the truth or validity about an ability, a talent, or facility that a person can put to constructive use. And this is all about someone's self-confidence. So at the beginning, it's really useful to know someone's self-efficacy or just their general self-esteem, and it's important to build that up if it is an issue, if it's identified as a deficit. So just put simply, is that individual confident that they can change their behaviour? How easy would it be for them to use more fruit and vegetables when they're cooking, to intake more fruit and veg? And next we have our intentions. So does that person or group of people have an intention to change at all? Do they actually want to carry out this behaviour? And a question that you could just ask here is, have you decided to eat more healthily? And the final domain in reflexive motivation is goals. So you can see already how this fits with intervention functions, but essentially goals are mental representations of things that an individual might want to achieve. So you could ask them, how much do you want to reduce your cardiovascular risk? What do you hope to get out of increasing your fruit or your vegetable intake too? And then finally, our final component is automatic motivation, and this involves our final 2 domains, which are reinforcement and emotion as well. Now, reinforcement is all about relationships or contingencies between the response and a stimulus as well. And this would include rewards and incentives, but also punishment and reinforcement too. And then finally, you have your emotion. So how will that person react to something that's personally significant to them? And things that can impact on behaviours are someone's fears and anxieties, maybe how much stress they're under, how they react to stress, depression, general mood. So are they more likely to be in good moods, bad moods? And then also the presence of burnout as well. All of this can affect emotions, which can impact on behaviour as well. So the question you probably need to ask here would be, does changing your dietary habits, does that evoke an emotional response? So that's a brief introduction to the domains in the theoretical domains framework. And these are important aspects of many behaviour change theories, and it's useful to just be aware of this. So you can investigate the domains by just asking questions of your target population, learn about that population, and where it's unavailable to ask questions, say to interview, to do individual questionnaires, it would just help to be aware of the individual differences that can impact so that contingencies can be made to address more of the population. So from a behavioural perspective, we know that attention and focus is difficult to keep up for a while. So just for 5 minutes or so, pause the video, step away from the computer, move around and grab yourself a cup of tea. And while you're doing this, just think about how you can even bring this to your own life, to work, or even in the process of creating interventions for others too. So do you find yourself sitting in front of the computer just staring into space or getting distracted by the tiniest thing that you see out the corner of your eye? And taking a break, even if it is super short, so just a couple of minutes, and getting out and moving is just really, really helpful for concentration and for focus. So 5 minutes. So now you're back, we can move on to evaluating our interventions. And evaluation of an intervention is really important in finding out whether the intervention you've designed has had the outcomes that you've hoped for. And if the intervention is effective, an evaluation can also help us to find out how that effect was achieved. Now, evaluation should be considered before and also throughout the whole process, and this just allows for outcome measures to be matched to behaviour change techniques and also for any implementation issues to be considered as well. Because at the end of the day, you do want to show that your intervention's been effective to potential stakeholders, so gathering that information as you go can be really useful. You can also work backwards to evaluate the effectiveness of an intervention. So if you look at any interventions and any that you're currently running, you can identify all your behaviour change techniques. Then you consider what intervention function they might apply to. And then finally, you would look at the evidence alongside this to say, well, has it worked in other areas and where has it been successful? And there are really complex ways to evaluate interventions, but there are also really simple ones as well. And today I'm just going to run through a few simple ones because the likelihood is that if you want a complex evaluation of effectiveness, you would work with an academic team to research it in more detail. So a really simple way to measure effectiveness is to just take a measurement before the intervention starts and then one afterwards. And if you have the capacity to do so, follow-up measures can be effective as well, particularly if you've worked to change a specific behaviour like exercise or smoking cessation. Taking one measurement at the end might be all well and good, but you do want to make sure that your behaviour is maintained. So it's worth looking at measuring after 6 months to see if that behaviour has been well established in your participant or in the population. And this 6 months is evidence-based in another theory called the theory of planned behaviour. Now, of course, you're going to get dropouts inevitably if you do something like this, but it is something to consider. And you'll want to identify exactly what it is that you'll be measuring and be conscious of not measuring too much, but know that there might be some other impacts as well. There are a few things to consider when you're taking measurements, particularly if they're subjective. So asking questions instead of measuring blood pressure or step count, and these are called self-reporting biases. So firstly, you've got your social desirability bias, and when a researcher or an intervention provider uses a survey or a questionnaire or an interview, and that's especially in the health field, the questions might include sensitive topics like diet or alcohol intake or sexual history. And so a person's responses might be affected by a bias caused by social desirability or their need for approval from you. And this is more so when anonymity and confidentiality can't be guaranteed. And in this case, objective measures are always useful to compare alongside. So next we've got our recall bias, and although it's easy to measure outcomes retrospectively at the end, there's something called recall bias that we need to take into account as well. So asking someone questions about previous events depends on someone's ability to recall a past event, and that can be inaccurate. when it comes to well-being measures or other measures that are investigating someone's feelings, people might look back on things with a more favourable view, so with rose-tinted glasses, or an unfavourable view, depending on their feelings at the time of the measure. Now, if you're not able to mitigate these through objective measures or ongoing measures, acknowledging your limitations and why these exist is useful for ensuring that your reports are more trustworthy at the end. And another thing to be aware of are interacting factors. So you might aim to change something, but unknowingly your participants might engage in a different behaviour that has your intended outcome or a different but related outcome. Or you might be the subject of another intervention. And this is definitely something to be aware of for population-based interventions, including public health ones. And again, in this sense, it's just something to be aware of. Being open and transparent is the best policy always. Now, in an ideal world, we'd be able to measure everything perfectly, but if you consider the appease criteria, they do need to be realistic. It can be perceived as a little bit invasive to measure someone's weight or to strap on a stepometer, so it's all about knowing your audience and working with that target group to understand what's acceptable to them. And for this reason, self-reporting measures are probably most commonly used in smaller scale interventions. Now, some things to consider when you're looking at self-reporting measures or questionnaires are, so you've got time, so do your participants have the time to complete, or is there a faster way that they can do this? The length of the measure, so the motivation to complete longer measures can lead to dropout. The number of measures. If you've got individual ways of measuring effectiveness for absolutely everything you want to change, that's a lot of paperwork for one person to complete. So is there a way that you can measure these differently to stop that from happening? Now, you need to consider the literacy level as well. So are the questions worded in a way that's easy to understand by everyone? You have your format, so can you measure what you need using simple tick boxes, because asking someone to write a lot about their experience might be a little bit off-putting. And a simple way to get around this, if you do want bigger opinions, is to just give an option to leave further feedback. And then finally, validated. So measures don't always have to be validated, but it does help. Now, if you're looking at improving wellbeing, a good questionnaire to use here is the Warwick-Edinburgh Mental Wellbeing Scale. It has 14 questions, or you can get a shorter 7-question one as well. And it's really widely used to measure wellbeing. It's a well-tested measure as well, so it accurately measures any changes in mental wellbeing. A widely used scale for measuring stress is the Perceived Stress Scale, which looks at personal stress. And it looks at the degree of how someone perceives situations as stressful. And then also the patient activation measure is a measure that's funded by the NHS, which looks at a person's knowledge, skills and confidence, and it's useful for just looking at how someone's able to manage their own health. If you want to use it privately, there is a cost associated with it though, but NHS England has a licence. I have linked all 3 of those scales in the description box below, and it's also been sent in the email that just includes absolutely everything too. Now, at a population level, things can get difficult because there's so many interacting factors that are going on. So if I give the example of Catch, which is an app that Damabu provides, our initial aim was to decrease inappropriate A&E attendances in under 5s. And we originally looked at measuring changes to A&E attendances marked as inappropriate, but we quickly realised that this wasn't really seen as effective when we were trying to sell to new stakeholders. And that was because there's just too many things going on that could impact the measure without doing a really complex evaluation. So we've got loads of these interacting factors. Now we rely on using in-app surveys, asking professionals and measuring how our users use the app. And public health measures can also take a long time to change, so this does need to be kept in mind and considered, and how you would approach this to show the effectiveness of your intervention. So the take home from this is that evaluation should be considered from the beginning. It shouldn't be an afterthought. And where possible, measures at multiple time points should be used as well, and it should follow the Pease criteria and equal measures where possible too. And that's just to make the whole process, including the evaluation, more person-centred. And that brings us to the end of the session and the end of the whole teaching series. So thank you so much for taking part. I'd be really grateful if you could fill out the feedback questionnaire, and that will help in my own evaluation, as this series was delivered as part of my professional doctorate in health psychology. Now, the questionnaire should only take 5 minutes, and it will be really, really useful for me to help me to improve my own teaching and training skills. Thank you.